Mexico for the sole purpose of getting plastic surgery, a tummy tuck, and then all of this now turning into death and disaster. It is very, very tragic. But what is this phenomenon, especially among some Americans who do travel to Mexico to get plastic surgeries, known as medical tourism? Let's talk about this even further. Dr. Bruce Hermann joining us right now. He's a board-certified plastic surgeon. Dr. Hermann, thanks for being with us. I think maybe, and you could correct me if I'm wrong here, this might come as a surprise to many people who are watching, that Americans seek out plastic surgery across the border in Mexico. Why do they do that?
Well, it all comes down to cost. Just like things that are getting outsourced to other countries, surgery is following suit. And so people can get plastic surgery cheaper in other countries, especially places like Mexico. And it may sound appealing on the face, but this is something that I think is very dangerous. And outside of this tragic accident with the cartel, there are other big risks that I've been talking about for quite some time.
Okay, we're just looking at some video from the scene. The surviving Americans were rushed across the border to this hospital there in Brownsville, Texas. But when you talk about cost, what is the differential that we're talking about? Is it that drastic?
So surgeries you can save up to about 50% by going out of the country. And so people see that and think, oh, hey, this is my opportunity to get this surgery that I want. But the issues are with the risks associated with going out of the country to a place where the physicians or the facilities may not be properly certified or licensed. And so that's my biggest concern when people go out of the country to get surgery, is that they may be getting worse outcomes.
Okay, but it is also, a fact that, some Americans might not have the insurance to cover a surgery here stateside, and that might not be required in Mexico. Are these procedures covered by insurance stateside?
Typically not. The procedure that the patient was going to Mexico to seek was a tummy tuck, which really is never covered by insurance. This is an out-of-pocket cosmetic surgery, which you can certainly have done in the United States, and you can actually have out of the country as well. And they can save money by doing that, and that's why it's appealing for some.
Okay, but aside from the cost element of this, we have seen now, I guess, the safety and security concerns play out on full display here.
It's tragic.
It is so tragic. What are the, I guess, requirements, the criteria, say, from a counterpart of yours in Mexico? Do they have the same qualifications as you?
Well, there are some great trained medical professionals and surgeons in every country, but my concern is that it's very regulated here in the United States. If you go to have surgery, you know that your surgeon's been properly trained and the facility has been properly certified. In other countries, you just don't have that guarantee. And so I'm not in any way diminishing surgeons in other countries, but we do have that stricter form of regulation here in the United States to ensure if you get a procedure, you get a surgery, it's going to be done properly, it's going to be done safely.
But when you say done properly, are there, health concerns if you don't know what you're getting into? Say, for example, this individual is going to get a tummy tuck. How does that procedure differ from, say, something you would perform here stateside?
I would assume it'd be very similar. I mean, I actually see patients all the time who had surgery out of the country. They come back home, they have complications, they have no way to go back to their surgeons. So I see these patients all the time. I have one in the hospital right now, tummy tuck done in Mexico. So the procedures themselves are very similar, but as I said, it boils down to the regulation of the facilities. Are they sterile? Are they following the same protocols and procedures? I don't know if they always are. Plus, you don't have that follow-up with your surgeon when you do medical tourism. That's one of the biggest complaints I have with it, is they have these surgeries, they're sent home a day or two later, and without the proper follow-up, small things can become very complicated very quickly.
And then ultimately, some of these patients, like you said, have to go to your office, correct?
Yep. That's it, absolutely right. They end up in emergency departments, and some plastic surgeons don't want to have to deal with other people's complications. I, of course, just want to help patients, so I end up seeing quite a few of these patients, usually about one per month, that went on some sort of medical tourism and had a complication for which I have to help them get through, which oftentimes requires more surgery and more cost. So then the savings that they had by going out of the country is lost.
Okay, but doctor, I think a lot of people who are just coming to this story would ask themselves, I'm asking myself, are there restrictions about, going across the border getting these procedures done? Are there laws on the books? Is there guidance from, medical entities, authorities, cautioning against this, saying you shouldn't do this?
I think that most physicians would caution people strongly about seeking medical procedures in countries that don't have this strict of regulation as the United States. So if you were going to Canada, say, to get a procedure, they have pretty good strict regulation. You could feel that overall it was going to be safe, at least from the regulation and certification standpoint. In other countries, you don't have that security. But the problem is if you go to some place like Canada, you're not really saving the money. When you go to these countries like Mexico, Costa Rica, Dominican Republic, where this is very popular, then you're getting those cheaper prices, but I think at an increased risk.
Yeah. Just lastly, doctor, do you think this will deter Americans, this story, from seeking this out, or is it going to be kind of carte blanche, as you say?
Well, I mean, this is something that I'm very passionate about. I see so many patients that have been injured from medical tourism. I've been talking about this for quite some time. I have a talk show that I do every Friday to warn people about certain things in medicine. I talk about this all the time, and I hate that this tragedy has brought this to the news, but I'm hoping that people will see this and think twice before they seek out medical tourism, which might cost them complications or possibly even their lives.
Dr. Bruce Hermann, we appreciate your time and your insight. We'll definitely be speaking again. Thanks so much.
Thank you so much. I enjoyed it.